When we think of balance, we've got to think of all of the things our mind has got to do to make us balance. And it's a very complex thing that our body does naturally. And we, of course, in ENT are involved in the inner ear part of it, but we do need to look at it holistically. So it's well recognized that three major factors are involved in balance. They're your vision, they're your muscles and your joints. So we rely very heavily on our neck, our spine, our hips and our knees to make us balance, and of course the inner ears. And whenever we consider balance problems, we need to think about all areas. So we do address all of the areas, but we focus, of course, on the area that we specialize in. There are a number of them, but I would argue that 95% of balance patients that we see fall into one of 4 or 5 situations. They either have had a viral infection, and they may have residual symptoms after viral infection, commonly called labyrinthitis. They may have an inflammatory disorder, commonly called Meniere's disease, where there's an abnormality in the inner ears in terms of the fluid pressures. They may have a condition which is related to position. So one of the common balance disorders is a positional dizziness, which occurs on turning. And the last one, which we always consider, is migrainous dizziness. And a lot of people with migraines can have dizziness associated with it. And those disorders together would explain a huge number of patients that any ENT surgeon sees with balance disorders. But of course, teasing them apart and getting a tailored plan for the patient is part of the expertise of seeing patients regularly with balance disorders. So when you have balance disorders, there's 2 main things we try and differentiate. One is imbalance. And if you think of imbalance, it's like standing on a boat, which is wobbly. So we can all have imbalance if we go on a boat, a small boat, so we have imbalance then. The other one is vertigo. And we can all elicit vertigo. So we've all at some point in our life spun around very quickly. And when you stop spinning around, you can feel for the first 5-10 seconds that the room is spinning around you. And that is vertigo. Inner ear disorders are very much characterized by vertigo. You may have imbalance with them, but the hallmark of inner ear disorders is vertigo. I've simplified to a degree because some people, when they describe imbalance, they also think about fainting episodes. But these other conditions are often related to areas well outside of ENT, and that fainting, for example, is much more likely related to neurological or even cardiovascular disease. So when we think of balance disorders, compared to most specialties, the diagnosis is very heavily based on history. Examination adds a little bit, but having experience in seeing a lot of patients with balance disorders really helps you with the history. So when people have balance disorders, the main factors I use are other associated problems, such as if they have an association with migraines, for example, if they have blood pressure problems. And I'd argue that probably the single most useful factor which you try and tease apart from the diagnosis is the length of the balance symptoms. So by that I mean, how long did they get vertigo for? And a very simple rule of thumb is that very short episodes are related to postural dizziness. Intermediate episodes, by that I normally mean half an hour to a few hours, are associated with migrainous or Meniere's disease type problems. And if patients have had any episode which has lasted for more than 24 hours, that's highly likely to be a viral inner ear infection, which can leave residual symptoms after the extended period of dizziness. Balance disorders, because of the nature of the name balance, can characterize a huge number of patients. And indeed, when we refer patients to balance disorders, they may be having completely, they may have a diagnosis which is completely outside of ENT. Within ENT, I guess the major crossover is when people have migraines, because of course migraines is very heavily managed by GPs in the UK and also by neurologists in the UK. So balance disorders can be associated with migraines as a major factor that we consider in ENT. But we also think holistically. So when we see particularly the elderly, The elderly patients can have a lot of other things going on with them. So balance symptoms can be part of what we call multifactorial dizziness. And that's when they can have an inner ear disorder, but they can also have partly an issue with blood pressure or also with joints, and they can be all be taken together to see what the overall cumulative effect on the balance is. When we treat balance disorders, I always tell patients there's part of the treatment is actually giving them the knowledge to manage a lot of it themselves. When people have imbalance, I often think of it similar to a sports performer having an injury. So if you have an injured knee, a lot of the treatment isn't surgery or medicines. A lot of the treatment is by physiotherapy, so it's exercise. So when patients have balance disorder, the first thing is exercise. We can, for some patients, give specific balance exercises, but for patients who are functioning at a higher level, it's just giving them reassurance that getting back to full activity is actually doing them a good service to strengthen their balance function. So that's the very first line, give them exercise or give them encouragement to increase activity. The next line above that is medication. And the question is, how much is a balance affecting the patients? There is a tendency in some people to massively overtreat patients with medicines. In some patients, they're much better served by avoiding medication the majority of time, but knowing when to use them. So they can simply use symptom relievers intermittently, and that works very, very well for many patients. There are, of course, some patients who need chronic treatment. Some patients have balance symptoms all of the time, and then you need to get to the diagnosis. So the question isn't that you treat balance, you're treating the diagnosis which causes the balance disorder. So there are certain drugs which are used in Meniere's disease, for example, and there's certain different drugs which are used in migraine disease. And patients with either of those conditions, they could arguably be having very rare dizzy episodes. Arguably, if you've got Meniere's disease and you only get dizzy twice a year, there's no point being on regular medication. But on the counter side, if you have Meniere's disease and if you get dizzy 2 or 3 times a week, then you may want to be in Meniere's specific medication. So you need to get a diagnosis for one, you need to know how often they're having it, and you also need to empower the patient so that they are encouraged to use whatever residual balance function they have to maximize their capacity.